Hi everyone, it's Dr. Stilwell from Stilwell Med Spa. Welcome to my virtual event. It's everything you're going to want to know about Sofwave. Tightening, face, neck, arms, legs, helps with cellulite. And you're going to learn all about how it does that today. And if you stay till the end and you participate in my question and answer, you'll maybe get a free treatment on your face and neck worth $3,000. Otherwise, anyone who attended today will get 40% off as long as you call by Christmas and book yours. So let's get started. So what is Sofwave? Sofwave is deep ultrasound heating that causes you to have a tightening in your face, your neck. You can do your arms, legs, and abdomen. It works by getting deep down inside. So when you leave here after a treatment, there's no downtime, no redness, nothing that needs to heal. It gets way deep down in those lower layers and causes a heat injury that then makes you make collagen and elastin and lifts everything that you treat. It's nice, it's small, it's easy to do. You need to be numb though, because it is a significant treatment. It takes about 45 minutes to do, depending upon what body part we're doing. And it's extremely popular. The technology is amazing in that you walk into my office and you leave an hour later and you already start to see the areas that you want lifted appearing right before your eyes in your after pictures. So here in the Med Spa, I offer multiple different modalities for getting things tight and looking better. Sofwave is the one that doesn't have any downtime and doesn't have any needles. So radiofrequency microneedling, you could get redness and have some bruising. With doing injection of fillers, you can also get bruising and have swelling afterward. And then with the lasers, you can also have bruising, redness, and swelling afterward. So Sofwave's a great option when you want to leave here and go right back to work and get a lift. Sofwave is FDA approved for lifting your forehead, your face, your neck, laxity in your arms, legs, abdomen, and improves the appearance of cellulite without any needles or downtime. So who's a good candidate for Sofwave? Sofwave is good for people who have heavy eyes, who have jowls, who have a loose neck, loose skin in the arms and thighs, who have cellulite that needs to be smoothed out. And it's a great option if you're on a blood thinner, because I don't have to take you off your blood thinner, and there's no bleeding that's involved with this. And you get the same as if you were doing a microneedling or having any kind of injections or laser. What's really great about Sofwave is there's no downtime. There's no redness afterward, no bruising, no swelling. And what's also good about Sofwave is that it does not destroy the fat under the skin as lasers or microneedling could possibly do if done too deep. You will see the results of this immediately, but then they get even better over the course of the next 4 months as your body builds collagen. And I have one of my lovely patients here, and she's going to explain to me what her issues are, and I'm going to give her an idea of some of the things that we can do here that can help. So give me an idea.
Okay, so when I look in the mirror, I see all this hanging. I would like this to be lifted, a little uplift in my cheek area. If my eyes can appear, I'm okay, it doesn't bother me, but it's just in here, like my neck, a little tightness and.
So one of the things that I have here at the office that really helps this type of situation where you don't need to have downtime and it works right away, but also continues to improve over the next 2 to 4 months afterward is Sofwave. Okay, the Sofwave is a ultrasound based heat system which doesn't do anything to your skin but gets deep down under the layers to help tighten by making you make your own collagen. Okay,
Right.
so initially when you leave the office you have a lift, and then over the course of several months you see it just improve. Do you have anything in the future?
So I do, I have a wedding in March.
Okay, so
And
it's
I
about
would
4
like
months.
that.
Okay.
I would like to be a little bit more, yeah, I look young.
Right, you want to be lifted?
I wanna-
So thank you everybody for coming to my virtual event. I just want to let you know that the person who wins the giveaway will be contacted, and then you will also be contacted, so watch your texts to be able to book a consultation. And I want to invite you to stay on, and I'm going to have a 15 to 20 minute answering questions if anybody has anybody about the Sofwave. And remember, to get your 40% off, if you would like to book, you need to say, I love Stilwell Sofwave. Good night. Everybody, now we're going to do the question and answer period. I can see the questions if you just want to type them in, and then I'll answer them as best as I can. If you have any follow-up questions after I answer the question, go ahead and ask those. I have, how long does the treatment take to do? It depends upon the area that you're having done. Typically, the area of the forehead takes about 20 minutes. The mid face takes about 20 minutes, and the neck can take 20 to 30 minutes. So a full face and neck takes about 45 minutes to an hour. If I'm doing the arms, it depends upon how big your arm is that we need to, and how far around we need to do for that laxity. So that's why I say come in for a consultation, and it'll let us know. You do need to numb for about an hour or so beforehand, because this is a significant treatment. You will feel some heat, which lasts maybe about a second of every treatment, but it's pretty intense heat, so we do need to numb you for that. Okay, what is the prep? So to prepare to have a Sofwave, I will usually have people come in without any makeup or cream on. We'll also clean that off when you're here. I tell people not to use certain chemicals in their skincare that could cause them to be more red afterward, like retinol or any vitamin A or vitamin C product. This way you just won't get that red afterward, and it won't be as sore. So that's usually the prep. You don't have to stop any blood thinners. There's really no other medications that you need to stop. Is the heat more intense than the cool peel? The cool peel, just to let everyone know, is a laser treatment, which is a mild CO2 laser. And the reason why it's called the cool peel is as you're having the treatment done, you really don't need to be numbed. And the laser itself doesn't hurt, but you become intensely warm after the cool peel. So it's uncomfortable for a few hours afterward. The soft wave, the heat is during the procedure, which is why you need to be numbed for at least an hour beforehand. And afterward, you leave here and you don't have any discomfort. Unless you go in the shower and let hot water hit your face, then you feel like you've had a sunburn from that day. But you don't leave here in any discomfort after the soft wave. If you are interested in a consultation, please select yes. Please vote. Okay, if I had threads done, am I still a candidate? Of course you are. Both threads as well as soft wave will increase the collagen in layers of your skin. Usually threads, which if anyone doesn't know what they are pieces of surgical stitch, which causes you to create more collagen. They were developed years ago. Instead of using silk to close up stitches, they generated this material, PDO, PLLA, which stimulates collagen. So this way people's wounds after having abdominal surgery, et cetera, would not open up because of the collagen formation. The stitches of the lifting threads usually dissolve with anywhere from 1 to 6 months after they're placed under the skin. So I would not do a soft wave within a couple of months of doing lifting threads or even smooth threads, just because you have a mechanism there that's doing the collagen formation already, although at a different level. It's a little bit deeper, but I would probably wait a month or two to let your skin heal after doing threads before I would do a soft wave. How often do you have to have this procedure done after your first time? It depends upon your level of laxity and how you respond to it. Some patients respond really well to one soft wave treatment. They get a nice lift, and over the course of the next 3 or 4 months, it just improves and improves. And then they just kind of stay at that good amount of lift. Some people, if they're pretty lax when they start, may need to do 2 to get to the point that they're happy. And I'll usually space them about a month to 6 weeks apart. And then usually every year or 2, if you're just doing soft wave as your treatment, then you would want to repeat it. Because remember, once we hit 25, we're losing 1% of our collagen in our skin every year of our life. Okay, so if we're going to battle losing collagen and we do a treatment, well, we can set ourselves back a few years, but then we still continue to age. So there's lots of different things we can do to stimulate collagen, between using retinol and doing laser treatments, doing microneedling, threads, injecting Sculptra, Radius type of treatments to improve. But one thing you have to do is not be in the sun where you're getting UV rays. The UV rays interrupt the fibroblasts, which is the cells that make your collagen, from making the collagen. So if you're going to have these treatments, I tell people you have to put sunscreen on it every day. They make wonderful sunscreens now, which is just feels like you're putting cream on your face, but you're getting SPF 30 to 50 sunscreen, and it prevents cancer, and it prevents you from losing collagen, and it prevents you from getting age spots that come from hyperstimulating your melanin, your melanocyte cells that also sit with your fibroblast cells in your skin. How much time before you consider a follow-up? Well, usually when you leave, you already start to see results. I ask people to come in a month and let me take pictures and see how they're doing. and maybe the month after that. You know how people are. They're too busy. They don't want to deal with traffic. They can't get here, etc. So often I'll just tell people to take pictures or take a little video going like this to this. Try to use the same background as I use here in the office if they are going to take a picture. Straight on, 45 degrees all the way. I usually have a series of 5 pictures I like taking. And then this way I can get an idea of how somebody is doing. So I tell people, don't complain to other people about me, and don't complain to other doctors about me. Come and complain to me and let me know what's happening, because I can't help you if I don't know where you're existing in your treatment course. So I can't say whether you need something else or whether we need to do another treatment or what's exactly going on unless you give me feedback. How much is it to have Sofwave done? Well, it depends upon what parts of the body that you're having done. As far as pricing, I'm fully transparent with my pricing. As you saw, this value of doing the whole face and the neck is $3,000. With today's being here at this webinar, you'll get 40% off. And one of you will get a full face and neck treatment, or both your arms or both your legs, for attending. I'm going to have a raffle when we're done, and then you'll be contacted. Sorry, I can't have the raffle on the line because of HIPAA. I can't be calling anybody's names out or letting anybody know that anybody else was at this. But the prices, what the full face and neck, you divide that up. A neck is $1,000, mid face is $1,500. Forehead is $1,000. Upper arm, it depends upon how big they are. If I'm doing my husband, it's more expensive than if I'm doing myself. So it all depends upon the area that we're doing the treatment in, and how many pulses of the Sofwave that I need to do, and how much time it's going to take to do it. The larger somebody is, the more time, the more expensive it's going to be. Not that much more than a smaller person, but you know how people's arms are. Some people are twice the size of somebody else. Let's see. So are there any other questions that I can answer? No, there's no side effects that I've seen. What's wonderful about Sofwave is it doesn't get deep enough to destroy your fat. If you dial up your microneedling, radiofrequency microneedling, or if you dial up some of your laser settings, you can actually get deep enough that you cause bleeding through the skin and you cause fat loss. And if that's the case, you can decrease the amount of fat in your face, in your arms. I mean, some places we do want to get rid of fat, back fat up here by our bra, some love handle fat. For those cases, yes, dial up, but we're not going to use Sofwave to try to get rid of fat. Yes, it can help the front of your thighs anywhere where you have skin laxity, or you have any cellulite. It will tighten the skin. So if you have loose skin, we can do Sofwave to help tighten that up. Yes, you can do the upper leg. You can do the lower butt. There's places where it's FDA approved to improve laxity, but for the most part, that's anywhere on the body. Can you tighten your belly? Yes, if you have loose skin on the belly, it can help to tighten that. Anything that causes your fibroblasts to stimulate collagen, and usually that's any form of heat. The sun, right? You go out in the sun, you get a really bad sunburn, and it makes you look and feel tighter. The problem is there's UV rays in that sun, and that causes your cells to convert their DNA and give you cancer. That causes your fibroblasts to die and causes your melanocytes to produce more melanin. So you get a tan, you cause cancer, and you decrease the amount of collagen in your skin. So even though you love the way you look because you're nice and tanned,
you're actually ruining your skin, that's why go out in the sun, but just wear sunscreen and reapply it if you sweat or go in the water. Let's see. A percentage of the amount of improvement that you'll see. I think it all depends upon the person. If you don't have that much to improve, you'll improve as much as you can to the point where your skin is tighter. If you have a lot of laxity to your skin, then you're going to get a certain amount of improvement. We are not removing skin here. We are not doing plastic surgery, but we're also not paying the prices of plastic surgery when it comes to what it costs, what your downtime is, and what your level of pain is. How many sessions would you need to tighten skin on the inner thighs? Depends upon your inner thighs. Just come in for a consultations with me. I'm a huge educator. Okay. I love to educate. Both my parents were grammar school teachers, and I just lived in a house where, learning how to clean the toilet bowl was fun. So just come in and I'll educate you in not only Sofwave, but every other device and treatment that we have here at the Med Spa. Because when I started this Med Spa, I didn't just start with Botox and fillers. And, that's all we're going to do. And we're going to fix everybody with Botox and fillers. Because if you just use Botox and fillers and even lifting threads, you'll make people look different. I don't want to make people look different. I want to improve their collagen. So I've gotten these devices because everybody's different and everybody needs something different. And therefore, we'll pick and choose what it is you really need. And always bring a picture of yourself 10 to 15 years ago, whether it be your arms, legs, face, whatever. And that'll be our goal. How long does it last? It depends upon multi-factors, how much sunlight you're getting, whether you're wearing skincare, what your lifestyle is like, how you eat, how you take care of yourself. So we can go into that with the consult, and I can tell you what daily routine you should have and what procedures you should and shouldn't do when you come for your consult. How fast will you see results? Most people see some result right as we're done with the procedure. I've yet to have anybody not start to see a lift right after the procedure. And then over the course of time, it improves. I can tell you from personal experience, having had one done. To be honest, every procedure and every machine that I have here in my office was because when I did a sample treatment, I saw results, right? Everything from my Emsculpt Neo to my CO2 laser to the Sofwave. So that's the reason why. Why would I get something that I didn't feel like that would work for somebody? That's just not me and my personality and how I want to take care of. Is this a business? Yes, but I'm in the business to please, not in the business to take people. So I can only say, try it. I think everybody who's done it has gotten some result, and then, keep track of your results and see how it is. And then come in if you don't feel like you're seeing what you want to see. Well, is it good for under the eyes? Well, if you are lifting here and you're lifting here, you can see that even if I lift as if I'm having a facelift, the pulling back always makes under your eyes look better, because a lot of what's happening here is coming because things are sinking over here. The same thing here. Everyone comes in, oh, I need to be filled here. No, you don't need to be filled here. We need to be pulling back here. And that's where Sofwave comes in, because if you pull back here, see how I've even left myself without having a Sofwave in a while, because I wanted you to see if I do have one, this is what it's going to do. It's going to give this bit. And see how around your eyes and your eyes get lifted. So it improves here, it improves here, it improves under your eyes, improves here. And then anything you do up here improves the neck. So I usually tell people, don't just do the neck. Don't just do the mid face. If you want your neck to be better, your mid face to be better, your eyes to be better, just do the whole thing, because you get, everybody works in concert to tighten even the neck. Elasticity issues aside, can stimulating collagen help someone turn back time as you have done? I'm a patient with described for saving my life, and I learn that every day. I think one of the reasons why people do aesthetics, and one of the reasons why I got into doing aesthetics was, COVID hit, and I was my mid-50s, and I started doing televisits like this. And I just looked at myself and I said, oh my God, I haven't been looking in the mirror to see, what I look like in other people's eyes. I look in the mirror and okay, this is what I look like. But now I'm talking to people, and I just felt like I was looking different. I wasn't looking myself. I didn't look on the outside like I felt on the inside. So that's how I kind of got into, and I always question, I need to know why. I don't want anybody touching my face unless they know what they're doing. So I needed to go train so I would know what I was doing, and then be able to get the treatments and know that I was getting the right thing done for me. And believe me, I did some of these machines that I regretted, because I didn't like the results from them, and I don't offer those machines in my office. But that's how I felt, and I felt that I could share it with others, and educate, not just say you need this and then do it to them, but tell them why and make you part of your own journey. Do you have skin products that are available? Yes, in the office here, we have medical grade skin products. What does it mean to be a medical grade skin product? It means that they have certain medicines in them at certain percentages that, you can't necessarily get in CVS. They've been developed by dermatologists. Things like retinol, some more natural substances, and also in such concentrated forms that you don't put much. I mean, what's on my face now is in a pea-sized amount of lipid serum that you just put a little bit and then rub it in, and it just makes you shine. And it gives, constantly gives you that moisture, and doesn't hurt if you put it on your eyelids. So yeah, we have a medical grade here in the office. So when you come in, we can give you and do a Visia analysis, which is a machine that I have that actually looks down into your pores and tells how much redness you have, how much bacteria you have living in your skin, what your actual wrinkles are like. And I follow people. So if you did a Sofwave, or you did any kind of treatment or skincare, we get a baseline Visia when you come in with regular pictures. And then after you do some treatment, 6 months, a year later, we show you, what you look like. And the machine doesn't lie, because it's the same machine for everybody. So it'll tell us, what treatments would be good for your skin texture and what you are having done, and also what products would be good in order to get your skin tighter. So if there's no more questions, I just want to remind everybody that you're going to get 40% off whatever treatment you want, as long as you call and book by Christmas. You don't have to do the procedure by Christmas. I'll let you move it into January, but by January 31st, you should have the procedure done. It's a good time to do the procedure because, what else are we doing in January, right? It's freezing inside. This is a nice hot treatment. Also, make sure that, we have your contact, which we have, so that we can let you know if you won. And it'll be interesting to see who won and what body parts they want to have done. Also, we're going to be receiving a text, reminding you that you were on this, and we just want to make sure we have your information. A couple more Questions came in. Is the Vizia part of your consultation? Yes, the Vizia is part of everyone's consultation. Everybody gets a baseline Vizia, whether you end up wanting to do anything or not. And then this way you can follow with the Vizia if you do decide to do any treatment. But I'll tell you and give you an actual copy of your results of the Vizia. Any other questions? Yeah, 40% off is whatever you book and pay for related to coming on this. So if you decide you want to do it, yes. GLP-1s, are GLP-1s a problem? Yeah, the only problem you get with GLP-1s is you lose the weight, but you also lose fat in your face. So you get what they've named Ozempic face, which is whereas you lose the fat in your face, everything falls. So being on GLP-1s is not an issue with having the Sofwave done, but the Sofwave is actually a good treatment because it helps to lift that skin that's gotten lax because you've been on GLP-1s. Sometimes you might need some filler if you really lost a lot of fat in your face. And that we will talk about at a consultation. Do you have a machine that takes a picture of your face and it shows you what you're lacking in your face? The Vizia machine actually, after it takes pictures of your face, it can show you what you're going to look like at 80 years old. It has an AI feature to it that'll show you where you're going to start to have wrinkles and the different types of treatments that you should do. It tells you where the bacteria is sitting in your face. It tells you where your pores are enlarged. And then I can explain to you how we can treat all of that. I'm sorry, what was it that you mentioned, the Vizia? Oh, that was the pictures, as I explained now, of all the different types of things going on with your face. And I do not charge for the Vizia. It's part of the consultation. It's just part of educating to tell you what's going on with you. Any further questions? Okay, so I'm going to wrap this up and just remind you the specials and remind you about receiving the text message. And if there aren't any more questions, I just want to thank you for coming tonight to the webinar. I hope I've answered your questions, but if I haven't, just make an appointment for a consultation. There's no obligation to come in, call the girls at the front desk. They can ask you, answer any questions that you might have. Thanks. Bye.